Synovial sarcoma is a rare and life-threatening cancer that typically presents as a painful lump around the knee, hip, ankle, or shoulder. While early diagnosis is crucial to potentially improve treatment outcomes, early disease testing, such as a biomarker test, can also help people better understand their treatment pathways. So Dr. Mihaela Druta with Moffitt Cancer Center is here to help us and tell us more about it. I think this is so fascinating. I love when we get the science and technology coming together to really help us with the things like this. So who should receive biomarker testing, and what do they do exactly?
So thank you for having me here for July Sarcoma Awareness Month. And I will start, before we're going to go into the biomarker testing, by defining what it is a synovial sarcoma. So synovial sarcoma is a rare and aggressive type of soft tissue sarcoma that can arise anywhere in the body, but usually presents as a painless lump around one of the large joints, such a knee or a hip or a shoulder. It is extremely important for the patient with synovial sarcoma or any other type of soft tissue sarcoma to be diagnosed early on, as they can benefit from a multimodality treatment with chemotherapy, radiation, and surgery. There are over 50 different subtypes of soft tissue sarcoma that is extremely important for the patients to be evaluated in a tertiary cancer center, where we have a team of physicians and doctors. They are specialized in the diagnosis and the treatment of this rare type of tumors. And you were asking about what is a biomarker testing, right? Biomarker is a biological substance that can be found in a patient's blood or in their tissue, and actually can help for further information and refine the diagnosis. But it's also very helpful for the treating physicians to make a more informed treatment decisions. It is extremely important for the biomarkers to be tested, to be performed early on in the diagnosis, as the patients can have access to clinical trials or even for the FDA approved treatment options.
Okay, and I mean, we hear this all the time, right? Early detection, early planning, early prepping, anything you can do ahead of time to be proactive. So who would you say should be getting this biomarker test?
So in general, patients that are diagnosed with a cancer, they can ask their treating physician and their treating team about the biomarker testing. And if there are physicians that are deciding they are eligible for the biomarker testing, they can explain to the patients how is this performed, and send the blood samples or the tissue samples, and then after they have the results, they can discuss further treatment options.
Okay, so where can we go for more information on all of this? I know it can kind of be probably confusing or stressful to a lot of folks who may be dealing with something like this. So where can they go if they want to read a little bit more?
There are a lot of great resources out there for sarcoma, and for biomarker testing, we recommend sarcomabiomarkertesting.com.
Oh, easy enough. Well, thank you so much for joining us today and empowering us to take our health into our own hands.
Thank you for having me here for July Sarcoma Awareness Month.
Yes, and everybody, talk to your doctors. Thank you so much for joining us. And if you'd like to see this interview again, everyone, just head to First Coast News Plus.